Everybody, welcome to Pick Dr. Osborne's Brain. Tonight we're going to be talking all about malabsorption. It's one of the critical missing pieces for many people who go on a gluten-free diet and fail to recover, fail to respond to their diet changes. And there's a lot of reasons why. We're going to be talking about different kinds of malabsorption. We're going to be talking about drugs that can cause malabsorption, surgical procedures that can cause malabsorption. We're going to be talking about missing nutrients that can make it hard for your gut to heal and pick back up where it left off. So stay with me to the very end. We're also going to be talking about strategies to overcome malabsorption problems and different nutritional support supplements that you can use in an endeavor to help your road to health and wellness. So welcome tonight. Now, before we jump into tonight's show on malabsorption, just a reminder, we're in the middle of this competition right now. It's the No Grain, No Pain Challenge, right? And so January and February have been months where we've been challenging our audience to follow along with the No Grain, No Pain Diet Challenge, Phase 1 and Phase 2, and to share your story. We've got some early feedback from one of our viewers that I wanted to share with you tonight, and so we're going to pan to this for you. So, hi, Dr. Osborne. After reading your email about your 30-day challenge, I knew I should take the time to write to you with my story. I'm not a newbie at this, but I have not shared this story before. When I was in my 20s, I did a bit of hiking and often had sore knees. In my 50s, I returned to hiking and again had a problem with sore knees. I gave up dairy products, and although my knee pain was less, it was still there. In my 60s, I decided to give up all grain, and my knee problem was solved. No pain. That's powerful. Now in my 70s, now this is critical to kind of let that sink in. This is a person who in their 60s and 70s resolved their pain problem. A lot of people, what are they in their 60s and 70s? They go to their doctor says, oh, you just have arthritis, accept it, it's a fact of life. This woman stopped grain in her 60s and resolved her arthritic pain. So she goes on to say, now in my 70s and still enjoying hiking, my knees are fine. In my regular hiking group, there are 6 of us women, ages 75 to 78, all eat well, no junk food, and are fit. However, a few of them eat a conventional diet that includes the bread I see them eat on our hikes. One has already had a knee replacement due to extreme pain, and the other is headed that way too. They take injections to control the pain, but they are still limited in what they can and can't do. I have shared my story with them, but unfortunately they do not want to consider that what they are eating may be contributing to their knee problems. There is no guarantee that going gluten-free will work for them, but it sure would be worth a try. I hope that this story will encourage somebody to at least try a gluten-free diet. That's from one of our listeners, Jane. So Jane, thank you so much for sharing that story with us. And you know, I agree. I think anybody listening to this and tuning in, look, take the testimonial and run with it. You have nothing to lose. I mean, it's knee pain. If you struggle, no matter what the pain is, whether it's joint pain, muscle pain, etc. You know, I've seen thousands and thousands of people go on a no grain, no pain diet plan and resolve their pain. So what have you got to lose? The only thing you really have to lose is a pain, right? So let's dive in now to some malabsorption. So let's talk about, before we get into this diagram, let's switch gears here. I want to go to what I call the malabsorption paradox. So what we see here on the board is malabsorption leads to nutrient deficiencies. And this is one of the problems, because when you have been eating gluten and you've damaged your GI tract and you're struggling with an autoimmune condition or autoimmune pain as a result of that exposure, generally speaking, you're already in a place where your nutrient status is compromised. You have nutritional deficiency. As I've shown you guys numerous times, you know, the average person with a gluten sensitivity diagnosis has multiple different nutritional deficiencies at the point of their diagnosis. So we know that gluten can cause, let's change our color. Gluten can cause malabsorption. It's not the only thing that can cause malabsorption, but again, many of you following along are gluten sensitive. So malabsorption leads to deficits in nutrients, and the nutritional deficiency inhibits your ability to heal. So it compromises the healing process. And then inhibited healing it basically equates to poor outcomes. So you've changed your diet, right? If you've gone gluten-free, but you have this malabsorption issue, but you fail to have a good outcome because of the malabsorption. This is one of the key missing links to those of you who've made diet change but didn't see the outcome or the result that you wanted to see. Now switching gears, so this is bad, but there's good news, and that's what this over here is referring to. What I want you to understand is that 60% of the nutrition to the gut, okay, of the nutrition to your gut, the cells in your intestines, the cells in your colon, the cells in your stomach, 60% of their vitamins and minerals come directly from the food that you put in your mouth. Unlike all the other tissues in your body, like your liver, for example, or your muscles or your joints, they get their nutrients from the blood supply. The blood delivers nutrition to those different organs, but your GI tract receives 60% of its nutrition directly from what you eat. That means all hope is not lost, meaning that even if you have a damaged gut with malabsorption problems, you can still get a lot of good nutrition from what you put in your mouth, right? And so this is key to understand. So directly from the food that you eat is going to be very critical and very important, but also it also tells us that nutrition supplementation done orally can also be used to overcome nutritional deficiencies. And I've seen this for 21 years in clinical practice, where we use sometimes higher doses of nutritional supplementation to correct malabsorption problems, because sometimes the body needs a jump start. Now, if we're talking about malabsorption, let's really define it. This is an image of the GI tract, right? From your GI tract is from your mouth to your anus, right? It's a tube that runs through your body, and it stretches and moves around, right? But it's a quarantine tube that's job is to separate the good things in your food from the bad things in your food, and to poop out the bad things, but to absorb, right, to get to the good things. What are the good things? They're the nutrients, the vitamins, the minerals, the carbs, the fats, the proteins, the things that your body needs to heal, to repair, to maintain normal function. And so as we look at this diagram on absorption or on the gut, it's also important to understand it's not just the stomach and the intestine that can create a problem. For some people, not for some, for all people, right, where does digestion begin? It actually begins right here in the oral cavity. You actually produce amylase in your saliva. What is amylase? Amylase is a digestive enzyme. So this is an enzyme that helps you start to break down carbohydrates in your mouth the second you put food in your mouth. So a lot of times we'll see autoimmune diseases like Sjogren's syndrome, which is an autoimmune disease that damages the ability to produce, dries up your salivary production and dries up your enzyme production. It can start to create malabsorption directly in the mouth. But we also know it's not just about the saliva. You also have teeth. These teeth, your dentition, if you will, your oral hygiene and the strength of your teeth and the quality of your ability to chew matter, because this is how mechanical digestion occurs. And so what happens to a lot of people is they have very, very poor history of taking care of their mouth, right? So they've got a lot of missing teeth, or they've got a denture issue, or they've got major pain, root canals and other things in their mouth from years of malnutrition. So teeth become a very important part, obviously, of how we're capable of breaking food down. Then we travel, once the food is chewed thoroughly, it's swallowed, it travels down the esophagus, hits the stomach, where we have acid and other enzymes that help to degrade protein, right? And so some people have a problem with what goes on in their stomach, because either they make low acid, they don't make enough stomach acid, so they can't break that protein down, or they're not producing adequate stomach protease enzymes. So really one of the primary ones is pepsinogen. Pepsin is a very important enzyme that helps to break down protein. And then we also have the pancreas, which is not part of the intestinal tract, but the pancreas is responsible for also making amylase. It makes lipase. It makes elastase. For starters, it also makes H2CO3, which is bicarbonate. to neutralize stomach acid. So the pancreas is very important, playing a role in helping us to break our food down. And so some people have pancreatic insufficiency, and we'll talk about that because that can be a cause of malabsorption as well. And then we also have the liver, right? The gallbladder, particularly the gallbladder, produces bile, which helps us to emulsify fat, which makes fat water soluble so that we can absorb it properly. And so some people have liver gallbladder problems, and so they're not making bile adequately, or they've had their gallbladder removed, and that creates this scenario of fat malabsorption, which can be a problem. So even though the liver and the gallbladder and the pancreas are not directly part of the GI tract, they're what we refer to as accessory organs. They aid in the digestion of our foodstuffs. And if these organs are compromised, not working right, have been surgically removed or operated on, then you can compromise your ability to digest the nutrients from your food, causing malabsorption, even though your gut might be fully intact, your GI tract per se. So your GI tract consists of the oral cavity, the esophagus, the stomach, the small and large intestine, and the rectum and anus. So now as we shift down and we move down to the small intestine, many of our digestive enzymes are produced in the small intestine. And then we have our colon, which is where a lot of our fiber is processed. A lot of our microbiome lives there to help produce vitamins and other nutrients from the fiber and from the foodstuffs. So again, we've got very important functions that go on in the colon in terms of our nutrition, and then we have the excretion process through the rectum and anus. So anything that compromises this GI tract's ability to do its job properly can compromise your ability to get to the vitamins, the minerals, the carbs, fats, proteins, nutrients in the food that you eat. So again, that was just a mini crash course to just provide you with the premise of understanding as we move into kind of the consequences of malabsorption. So now moving over on to the next slide here, what we're looking at here, you see here macronutrients. This is macro, meaning large. This is your fats, your proteins, and your carbs. And then we have micronutrients, which are your vitamins and minerals. Now, why are these so important? So the macronutrients are how we generate energy, right? We generate energy from fat. We generate energy from carbs and protein. Protein's also very important for structure formation. So what is that? Remember, protein, that's your collagen, your soft tissue, your muscles, your tendons, your ligaments, your cartilage, right? The things that you need protein to make. Your immune system relies on the protein to make antibodies to protect you from colds, flus, and other infectious microorganisms. So these macronutrients become very, very critical to your body's ability to generate energy and to also for formation of structural elements. Now, energy, we sometimes refer to this biochemistry as ATP, adenosine triphosphate. And so a lot of people think of energy as like, I'm zippy, I'm peppy, I've got plenty to go, plenty in my gas tank. But I'm talking about biochemical energy here. I'm talking about the ability for your body to generate the substance ATP. ATP is a lot like money in the real world. You need money, right? Why do people need money? They got to be able to buy their food, buy their clothing, buy their shelter, provide for the necessities of life. That's what money does in the real world. Well, ATP does that necessity of energy production in your body so that your body can heal and repair and maintain its integrity, its tissues, and its functionality. So macronutrients are very, very important. Now in America, we don't have macronutrient deficiencies unless we have major malabsorption problems. The most common type of macronutrient malabsorption is fat. And this happens a lot of times, especially it happens in diseases like inflammatory bowel problems. And this, one of the most common is celiac disease, which is caused by gluten, but we also see diseases like Crohn's, ulcerative colitis, and Crohn's disease, which are also inflammatory bowel diseases. So these three conditions oftentimes lead to fat malabsorption. And so what we'll see in fat malabsorption is again, fat's a major substrate necessary to produce this right here. So we'll see a lot of fatigue in these individuals, and we'll see a lot of wasting. This is why a lot of times people that present with inflammatory bowel disease with chronic fat malabsorption can't put on mass, can't put on weight, have a hard time keeping their weight up. because they're malabsorbing one of the major nutrients that help you generate energy. But remember too, fat isn't just the substance that stores in fat cells. Fat, vitamin A and vitamin D and vitamin K and vitamin E are all fats. Omega-3 and omega-6 are fats, and omega-9. These are essential fats that are required to regulate inflammation and to regulate blood viscosity and to help form the nerve coating, the myelin sheath around your nerves and the white matter in your brain. So a deficiency of fat can lead to a whole slew of major problems. Just looking at the vitamin deficiencies alone, the fat-soluble vitamin deficiencies and the symptoms associated with those, you can go back and review some of my master classes on these vitamins and these nutrients, because we could talk for hours and hours and hours about the signs and symptoms of deficiency, the disease states of deficiency. But this is, again, the most common, right? It's one of the primary types of malabsorption is fat malabsorption. Now, hallmark of fat malabsorption, if you struggle with chronic diarrhea, right? So if you have chronic diarrhea, or if you have tan or clay colored stool, then you are malabsorbing fat. That's what that means. That tan discoloration or clay discoloration of the stool is actually fat discoloring your stool. If you have chronic diarrhea, there's a great likelihood you're malabsorbing fat, and not just fat, you're probably going to be malabsorbing all of the macronutrients. But again, fat is one of the most common. In fact, it gets a bad rap, right? If you go back in time, even just a couple of decades, what did we think about fat? Or not we? What was mainstream media, mainstream medicine touting about fat? We're saying fat's bad for you. Fat's evil. Fat's the cause of heart disease. Fat's the cause of all of our ailments. Fat's the cause of obesity. And so we went through this, decade-long onslaught of attack against fat. And so what happened there was the low-fat, no-fat diet. So all these processed foods were being produced that were low-fat. They were replacing basically fat, a substance in food, with carbohydrate to sweeten it so that it was palatable and had a taste that somebody could like. And so for 10 years, the mainstream did this to the diet, and the people that followed these low-fat diets, what happened? They became severely deficient in these key critical nutrients. And did they get healthier? No. Did they lose weight? No. They got sicker. We saw more heart disease. We saw more cancer. We saw more diabetes. We saw more obesity, right, as a result of low-fat diet. So not only is not eating enough fat a bad thing, malabsorbing fat can lead to that same bad thing, and we want to be careful about the potential there. So again, if you're struggling with diarrhea, clay, tan-colored stools, those are just some of the physical ways that you can identify the manifestation of malabsorption, particularly of fat. We also, though, have, so let me make some room here, we also have malabsorption of other nutrients, and this is another, again, it's super common, malabsorption of micronutrients, right? So micronutrients being your vitamins and your minerals, what I like to refer to as the molecular workhorses of the body. Without vitamins and minerals, your body can't heal, can't repair, can't do what it's supposed to do. These run a lot of the machinery, the little microscopic machines that, the enzymes and the other chemical reactions, you need vitamins. That's why vitamins are oftentimes referred to as coenzymes. An enzyme is a protein motor that your DNA builds, and it usually has a function. Some enzymes build hormones, some enzymes build proteins, some enzymes put protein and fat together to form a new molecule. Well, a coenzyme is like the key that starts the motor, and that's what vitamins and minerals are. They're coenzymes of these little motors produced by your DNA that help your biochemical functions move along aptly. And so without micronutrients, you're not going to heal. So you have reduction in the ability to heal. And so what does that typically look like? Clinically, it looks like prolongation of illness despite diet change. And that's why we're talking about this tonight, because if you've changed your diet and you're still struggling, but you haven't addressed whether or not you have a malabsorption problem leading to micronutrient deficiencies, then it wouldn't surprise me if this is you. If this is you still struggling at finding a path to wellness and finding a way to feel better and have more energy and to heal more responsively, not need medicines, not have to treat symptoms, etc. So Macronutrients, micronutrients, very critical. This is what is malabsorbing. So when we use that term malabsorption, we're talking about malabsorption of these things, right, which are, again, the components within our food that allow our body to heal, repair, and maintain its normal function. As I mentioned earlier, some symptoms of malabsorption, again, the light-colored stool, the tan or the clay-colored stool, that's fat malabsorption typically. But sometimes what we'll also see is foul-smelling stools, and this is kind of more, so if this is fat, a lot of times this will be protein malabsorption. The proteins, when they're not properly broken down, they form different byproducts that can cause a very, very foul odor within the stool. And so again, if you've got, if you go to the bathroom, and not that stool is supposed to smell wonderful and flowery, right? But if you, there's a difference between how it smells and when it really, really smells quite foul. And if that's you, you might consider that you are suffering with a protein malabsorption issue. Floating or sticking to the side of the toilet bowl, this is also can be oftentimes fat malabsorption as well, especially the floating. It's the fat, right, that is present in higher quantities that leads to that floating stool versus non-floating. So again, these are just things you can look for if you're trying to understand whether or not maybe some of this is happening to you. Physical symptoms that you can pay attention to in your bowels directly. Okay, let's talk about other things that can cause malabsorption, because this is very, very common. A lot of times when people come to see me in my practice, a lot of times they've been to 7, 8, 10 doctors. They're on multiple medications. They're struggling to find an answer. That's why they're in my office. And it's a very common trend that we see people on multiple medications. As a matter of fact, I had a woman here last week. She was on 15 different medications. She had like 6 different doctors. None of the doctors were talking to each other about her medicines and the interaction between her medicines or the damage that her medicines could do to her GI tract by causing malabsorption. And so here she was being told she had to take these chemicals to suppress her symptoms. She wasn't getting better, and she was stuck, right? And this is a common scenario that I see. So these are just some examples. Antacids, reduce stomach acid, right? That's what they do. They block your ability to produce stomach acid, which is going to cause what? It's going to cause protein malabsorption. You're not going to be able to break down or digest your proteins. But some of the minerals also require acid to be absorbed. So minerals like calcium and magnesium and zinc and selenium and chromium and copper require acid in order to properly be absorbed. So if you're blocking your stomach acid, taking the pink stuff or even some of the over-the-counter remedies and some of even the prescription remedies or the prescription PPIs, things of that nature, you're causing protein and mineral malabsorption. You're also causing, it's not just mineral, but B12 requires acid to be absorbed, and so blocking acid oftentimes leads to vitamin B12 deficiency. We also know antibiotics can cause malabsorption. They do this by damage to the microbiome. So if you, functionality-wise, they damage the bacteria that thrive and survive in your GI tract. The bacteria, remember, what do they help you do? The normal healthy bacteria in your intestines help you digest your food. If you wipe them out on a frequent basis by popping antibiotics every time you get a fever, this is especially true. We see this very commonly. Pediatric practices today, then kids got a snotty nose, they get an antibiotic. Like, it's insane. It's insane how asinine we've come, how far we've come in such a terrible direction where it doesn't matter. Doctors don't do cultures anymore. They don't confirm bacterial infection. They just write the prescription despite damaging the microbiome, which is so critical to human health. And so we see this deterioration of the human microbiome over the last several decades. It's no wonder our kids are so sick, struggling with asthma, struggling with obesity, struggling with multitudes of immune problems. And again, those antibiotics can be a major part of this problem because they damage your microbiome, and your microbiome, not only does it help you digest your food, but you remember your microbiome also produces vitamins. So a number of your B vitamins are made by your good bacteria. Vitamin K, K1 specifically, is made by your gut bacteria. And really about 60% of your daily need for vitamin K comes from your microbiome. So if you're taking antibiotics on a frequent enough basis, you're going to create nutrition deficit as a result. Chemotherapy, this is something we see all the time, cancer patients. Chemotherapy destroys the GI tract. And so this is why one of the side effects of chemo is severe nausea, vomiting, and diarrhea, because it destroys those very, very delicate cells. And so, again, the problem in cancer is, doctor says, eat all the foods you want, we just want you to keep your weight on. Well, it's because they're giving you a poison that destroys your GI tract and causing you to become malabsorbed. How are you going to fight a cancer if you're malnourished? Like, it makes almost zero sense to do this to somebody without addressing the nutrition. But how many oncologists, how many times have you been or seen one of your family members with cancer, have an oncologist order a vitamin mineral deficiency test to help support them on their cancer journey? It happens 0% of the time in my experience. Now, maybe you've got a different experience, but in my experience, 21 years, I've never seen it. I've never heard of a cancer doctor making these kinds of recommendations to help somebody with their nutrition. We also got drugs like ARBs. ARB stands for angiotensin receptor blocker. It's a type of blood pressure medication. These drugs, about 137 studies have shown that these drugs can cause villus atrophy, and it matches or looks just like the villus atrophy that can be caused by gluten. So what we would call celiac disease, right? Gluten causes flattening of the folds of your small intestine, leading to malabsorption. This class of medications can cause villus atrophy. And so you have to be very, very careful. If you're on an angiotensin receptor blocker for your blood pressure and you have problems in your GI tract, you need to have that conversation with your prescribing doctor that this is a possibility, that you're taking a medicine that could be causing malabsorption syndrome. There have been a number of studies published on this, a more recent one published at Mayo. Then we have a drug class called bile acid sequestrants. Now, these are an older class of medicine. These drugs are used to reduce cholesterol. Now, not commonly prescribed as they used to be, because statins, a newer type of cholesterol-lowering medication, are what most doctors use. But some people don't tolerate statins, and so a lot of times the doctors will reach for bile acid sequestrants. And what do these do? They basically cause malabsorption of vitamins A, D, E, and K, and then other fats, right? So your omega fats. And so over time, you multiply taking something like this out over 2, 3, 4, 5 years, and you start to see malabsorption really setting in. And then fat malabsorption is a very bad deal. You don't want to go that road. Now, a few that I didn't mention here, a few of them, non-steroidal anti-inflammatories also cause damage to the GI tract, leading to malabsorption. We also know that steroids, so if you're taking chronically, if you're taking oral steroids like prednisone, corticosteroids, we know, and if you're mixing these two, the damage to the GI tract is about 8 times more aggressive than if you're just taking one by itself. We also know medication that's commonly prescribed and over the counter is aspirin, and we know aspirin in baby aspirin, which is about 81 milligrams. So if you were to cut an 81 milligram aspirin into 10 small pieces, each of 8 milligrams each, that 8 milligrams, 1/10 of a baby aspirin, is enough to cause damage to your mucosal barrier in your stomach and cause gastric bleeding. 1/10 of a baby aspirin can cause gastric bleeding and damage. So again, if you're taking these things chronically, I'm not talking about I had a headache once and I took a little bit of aspirin. I'm talking about if you're using them on a regular basis, you're going to run into a major problem, again, with the drugs creating damage to your intestinal tract, leading to the potential for malabsorption, nutrient deficiency, and lack of healing. Let's talk about some surgical processes or procedures that also contribute to malabsorption. One of the most common surgeries in the U.S. today is a gallbladder surgery. And I see this most commonly, at least in my own experience in my practice. I'd say half the people that come to me have already had their gallbladder taken out. And actually, in my opinion, they didn't need to have their gallbladder removed. It's just that they had pain and their doctor said, you don't need your gallbladder, let's remove it. Remember going back to like the 70s, in the early 80s, when pediatricians used to take out children's tonsils, right? It was one of the most common surgeries. They would just say, you don't need tonsils. It's inert tissue. You don't really need it. And tonsils are a major part of the immune system. It's what protects kids. But they were removing tonsils. Well, they do that to the gallbladders nowadays. They say, you don't need your gallbladder. You still have a liver. The gallbladder is very important. It's what regulates the secretion of bile, right? And you need bile to absorb fat. So gallbladder removal, or oftentimes referred to as cholecystectomy, is one of the major causes of malabsorption. A lot of people overweight, obese, they get these gastric bypass surgeries or these band surgeries. You understand that when you bypass your stomach, you're creating a host of malnutrition problems long term. And that's, there are different types of medical procedures. I mean, in some cases, they're bypassing the whole thing. In other cases, they're bypassing a part of the stomach, or they're banding part of the stomach to make it smaller so that you get fuller and don't eat as much. But when you do that, remember, there's less surface area for your stomach to generate what it needs to generate. What does the stomach produce? It produces intrinsic factor to help you absorb vitamin B12. It produces pepsin. It produces hydrochloric acid to help you break down your proteins. So what ends up happening is malabsorption, again, as we talked about earlier. Colon resection, I see this quite a bit too. It's when somebody has had an inflammatory bowel disease, like an inflamed colon, and the doctors don't know why. They just say, let's remove 6 inches or let's remove 8 inches. And then they remove a big chunk of a person's colon because the inflammation is being uncontrolled. And that, again, that leads to lifelong. Anytime you remove part of the organ, that's lifelong potential for malabsorption. Pancreatic surgery. I've seen cases where people had parts. You can't remove the whole pancreas, but a lot of times I've seen people where they've had parts of their pancreas removed. And remember, when you have the pancreas, what does it do? It produces digestive enzymes. Aside from making insulin, which is important for controlling blood sugar, the pancreas has an exocrine function, which is it makes enzymes and bicarbonate that help you to digest your food and neutralize the acid as it's pouring from the stomach into the small intestine. So again, another issue here. So if you've had any of these things, and you didn't have what we would consider to be a nutritional, pre-surgical nutritional consult, meaning that they should have prepped you to understand that when you do this surgery, this is the lifelong risk of malnutrition that you're going to be facing. And these are the things that you need to focus on doing in order to offset as much of that as possible. Now, I've seen thousands of people with post-surgically like this, and not a single case has somebody been properly educated after having one of these procedures. Again, that's my experience. Maybe other doctors have different experiences with that, but I've never seen a single case post-surgically where a person had the right informed consent to understand that the organ removal or the resection was going to lead to lifelong malabsorption and malnutrition issues. So then we get them in after 5 years or 10 years later, and there's severity of nutritional deficiency associated with this, and that again can pose a major problem to that individual. So these are all things that you want to be concerned with, because again, if you have malabsorption, you've got to address it. You've got to address it. And sometimes that means your gut has to be properly addressed. There's got to be some healing that occurs within the lining of the GI tract. Sometimes that means you have to, not sometimes, in my opinion, 100% of the time, what it means is you need to have your nutrition status measured. Because sometimes it requires higher doses of nutritional supplementation to overcome the years of damage. Remember, going back to that very first slide that I showed you on malabsorption, which is right here, nutrition deficiency inhibits healing. Inhibited healing equals poor outcomes. So if you're malabsorbing, this is you. Right? So how do you stop this cycle from happening? Well, number one, you have to change your diet. And so getting your diet dialed in so that you're no longer damaging your GI tract becomes very important, because this is one of the biggest reasons why this happens in the first place. Gluten, other food sensitivities can also do it. Food allergies can do it. This is not just gluten, but it's other foods. It's chemicals in the food like pesticides. It's drugs that you take, it's surgical procedures that maybe you've had done. Like all these things we talked about tonight can contribute to and lead to this scenario, which is poor outcomes for you. So if you're here at the poor outcome, what do you do? Like what is it that you do? Let's shrink this down and talk about what to do next, right? So if that's you, number one, measure your nutrition, your status, right? Measure your deficiencies. and this is most important for your what we talk about, vitamins and minerals. It's also important, to look at, in many cases, the amino acid levels of a person. So the amino acids are the breakdown byproducts of protein. It's also important to look at your omega-3 fats, because a lot of times these are crucial and they're part of why a person's not repairing or not healing. So at the very bare minimum, these things should be measured. Measuring them, why? Because if you have a deficiency, then what needs to happen is appropriate supplementation. And this, again, sometimes the doses matter. A multivitamin's not going to cut it if you've got damage to your stomach and you're malabsorbing, and you're not making enough intrinsic factor. You're not going to absorb, the B12 from a multivitamin. It's not going to be enough to overcome, the potential need that's going to help your GI tract heal and repair. So again, it's supplementation with the right dose, with the right amount. This is where a lot of people fail, is that, they use products, some of these over-the-counter multivitamins you buy at the local drugstore. Most of that, first of all, it's junk. It's filled with trash fillers, gluten fillers, sugar, all these gummy candies that are supposed to have vitamins in them. It's all garbage with corn syrup, and you're just doing yourself more harm than good. You've got to get the right amount of supplementation if you're going to overcome a problem like this. But even more importantly than measuring this is ask why. Ask why it happened in the first place, right? Why did the malabsorption happen? And again, for many of you, it's the diet. You're eating gluten, you're eating grains, and you're gluten sensitive, and so you're causing the problem by what you're eating. You're causing the damage. What damages the GI tract directly? It's what you put in your mouth. And if any doctor tells you differently, you probably ought to look for somebody who's more of an expert. If you've got inflammatory damage in anywhere from your mouth to your anus, and you haven't had your diet analyzed as a potential cause, then your doctor's not doing his or her job. And so it falls onto you, now that you know this information, to get and find an expert who can understand this. Ask the bigger why, because no amount of medicine that blocks the way your GI tract works, right? There's a lot of different drugs that affect motility, and that will affect pain levels or affect gas and bloating, etc., that you can take, right, that are just basically masks to the actual problem, but you've got to ask why. So once you know what the why is, you address the why, you measure the nutrition status so that you can address what may be lacking, so that your body has the ability to recover properly and heal and repair. So that's a crash course on malabsorption. Let's dive into the questions. So I get really bloated and constipation. I have celiac and SIBO. I'm very careful with food. I looked at the list in the email, and that's what I do. Please help. Gina, if that's the case, if you're doing everything you know to do and you're still struggling, you've got to get tested. Like, at the end of the day, I have an adage, and this is in No Grain, No Pain. It's in one of the very last chapters of the book. Test, don't guess. Everybody's unique and different. One man's food is another man's poison. You could be reacting to the most healthy foods in the world. I've seen cases, one of the stories in No Grain, No Pain that I wrote about, it was Ginger's story. She's a little girl with a terminal diagnosis. She had 6 months. Her rheumatologist gave her mom, he said, your daughter has 6 months to live. Go home and get ready. She's going to die, right? And this little girl, aside from being gluten sensitive, was allergic to blueberries. And had we not tested her, we never would have found that out. We never would have gotten a resolution in her case. So this goes back to you test, because you may be doing everything right. You may be following No Grain, No Pain exactly as spelled out, but you also may be reacting or allergic to some of the things that are, generally speaking, are healthy things, but for you they're not. And that's really where you've got to get clarity. And testing is what helps to provide that clarity. Let's see here. What about heavy metals and gut inflammation? Well, heavy metals can certainly cause it. And where do most people get exposure to heavy metals? In today's world, if you're a massive fish consumer, there can be mercury in a lot of the bigger fish, like your larger Cold water fish can contain mercury. But where a lot of people get exposure to heavy metals, you're never going to believe me when I say this, one of the places is rice. And rice has been shown to contain cadmium in high amounts, arsenic, and lead. These are heavy metals, right? And then you also have halide, which isn't a heavy metal, but fluoride also can damage the gut. And where do we get fluoride? Every day. If you drink city water that's fluoridated, if you're in the U.S., the water's fluoridated here. If you're not filtering that nonsense out, you're getting hammered with fluoride. Remember, fluoride's also a pesticide, so it destroys your microbiome, as does chlorine. We could put chlorine on this list as well. These things are not good for you, but they're put in all of our water in an attempt to prevent cavities with fluoride, that's nonsense. And then the other with chlorine, it's to prevent bacterial infection or spread through water, which is not a bad idea, but you do want to filter it out, before you drink it, so that you're not just chlorinating your GI tract constantly, because both of these substances are natural antibiotics. I mean, they're gonna knock out your flora over time the more you consume them. So heavy metals through that, and then the other place we see heavy metals really is kale. Kale is one of the biggest sources of thallium exposure. And a lot of people juice kale en masse, right? They buy all this kale and they just dump it in the juicer. And I see it all the time, thallium toxicity in people that are aggressively juicing. This is especially true in people in the vegetarian community who eat in my opinion, an overabundance of it. And there are a number of reasons why. Thallium is commonly found in organic fertilizers, and kale is like a thallium magnet. It just pulls it right out of the soil. It detoxifies the soil, but now you have to contend with it if you're doing a bunch of kale juicing. How long would it take to feel a reduction in pain after stopping grains? It's different for different people, Robbie, but most people within 2 months are noticing some pretty dramatic change and improvement. I just talked to somebody earlier today, and she has only really been going grain-free for a few weeks, and she's already noticed a dramatic improvement in her pain levels. So, again, everybody's story is different, but for most people, a couple of months, unless you're missing a major key element. When should you follow up after having an initial food sensitivity test? When should you follow up what? When should you follow back up with your doctor? I don't understand your question, Morgiana. Maybe clarify it a little bit more and I can give you a better answer. Is gray hair an indication of food malabsorption? Depends on when you get the gray hair. So if you're really young and you're already seeing premature graying of the hair, yes, it can be. Graying hair early it can be a symptom of vitamin B12 and vitamin B5 deficiency. So, again, that's saying that maybe you're malabsorbing nutrients, and B12 and B5 are two of the nutrients you're malabsorbing. Gray hair can certainly form. There's also something called a flag sign, which is like a patch of gray hair that clusters in one region or one location. That's very, very common to see that symptom physically. What do you recommend for somebody who's had their gallbladder removed? If you've had your gallbladder removed, you've got to really understand that you've got to have some type of help with. One of the things I recommend is a product called Lipogest, and it's got bile and some other ingredients that help you to emulsify and digest fats and fat-soluble vitamins appropriately. It's called Lipogest. And so that's something, again, your surgeon should have had a pre-nutrition surgical consult to inform you that may be something that you need to do to support your ability to digest fat as you move forward in the world without a gallbladder. But that's one of the supplements I recommend to support your ability to properly absorb fat. Let's see, Sheila says, other than all the other intestinal issues like celiac, lymphocytic, colitis, and diverticulitis, a gluten-free diet wasn't helping no matter what I eat or drink. I immediately have bloating pain. Had a current EGD done and was diagnosed with pyloric stenosis, gastritis, and my GERD was so bad it's inflamed my esophagus to the point of losing my voice intermittently. I understand that pyloric stenosis is rare for an adult, very rare as a matter of fact. Are these newer issues tied to the original issue? Yes. So I've seen cases of pyloric stenosis where gluten was responsible for the damage. So understand that those of you who don't know what pyloric stenosis is, there's a valve in your stomach, and what happens is it won't release, it won't open, and so the stomach contents will regurgitate back up into the esophagus, creating inflammation and irritation. And it's more common in pediatric kids, like kids who are very, very young. When we're talking about before the age of 2, it's very uncommon in an adult. But they can do a surgery where they can release that valve. They can basically open it up so that it's no longer happening. But it's possible that you haven't been gluten-free, I would imagine, your entire life. But it's possible that gluten caused it, and the damage was so severe that even getting off the gluten, the damage was still very, very bad, and it couldn't fully heal because once that valve was constricted and not releasing, things just kept regurgitating up. So that's a potential reason as to why. There certainly are other reasons, but if you have that released, or I don't know what your doctors are doing with you, but once you get that corrected, you should still maintain a good diet, because that's what's going to keep you healthy as time goes on. How do we resolve swallowing issues? Depends on why you have swallowing issues. So, you can have swallowing issues for a lot of reasons. For some, you get spasm in the esophagus that narrows and constricts it. For others, enlargement of the thyroid can put pressure into the throat. For others, tonsillar swelling can make it harder to swallow. For others, sympathetic tone, and too much sympathetic tone can make it harder to swallow. I mean, it's not a simple question, and we could probably do a whole show on swallowing conditions. But I would say start with diet change. Start with diet change first. And if you're having trouble, one of the things that we have people do who have really severe swallowing issues is we have them puree their food. So get you like a good Vitamix, industrial blender, and puree a lot of your foods into, liquefy them so that you don't have to chew and you don't have to swallow big bits. It goes down a lot easier, more in a liquid form. And sometimes people have to do that temporarily until they actually heal. Does malabsorption create or help induce non-alcoholic fatty liver disease? It can, because your liver needs key nutrients are required for your liver to properly process fat. And so when would your liver store fat? Well, number one, we talk about choline and inositol. These are two B vitamin-like compounds that, when deficient, contribute to fatty liver, because your liver requires these two compounds in order to properly metabolize and deal with that fat. So malabsorption can lead to choline and inositol deficiencies that could contribute to fatty liver. We'd also add B12 to that list, because B12 deficiency can also contribute to fatty liver. Leaky gut can contribute to fatty liver because of certain bacterial toxins can leak across an intestinal permeable situation, directly go to the liver and cause liver damage. So lots of things can do that, but malabsorption certainly on that list. Let's see here. Do you have any recommendations for genetic ApoE, E3, E4? Just got these results today. LDL 164, total 255, triglyceride 73, gluten-free, awesome, feel good. So my advice, Elizabeth, is simply this. ApoE, genetics, for those of you maybe don't know, some will say that if you have ApoE3, 4 genetics, then it increases the risk of dementia and heart disease. I don't agree. I think we might see that there is a genetic preponderance toward that, but not if you're doing all the things right in your diet and your lifestyle. And so my recommendation is you get customized with your diet, with your exercise, with your sleep, with your sunshine, your air quality, and don't keep yourself awake over worry, because generally speaking, your genetics don't determine your fate. And a lot of practitioners I see, this is especially true in today's world, they do all these genetic tests, and then they want to pump you full of pills based on your genetic variances, or what are called SNPs, single nucleotide polymorphisms. And, the vast majority of cases in time, people shouldn't supplement their genetics, because you understand your genes aren't to blame. Generally, it's not your genes, it's your choices. And if you have certain genes and you make certain choices, then you have a greater risk. You can't change your genes, but you can change your choices. And so most people try to change their choices passively by taking on gobs and gobs of pills to overcompensate for a genetic mutation. And it's the very wrong approach. As a matter of fact, I can speak from about 5 years of clinical experience. I helped design one of the very first genetic SNP tests direct to consumer available. And what we saw in years of research of trying to address SNPs with nutrition is we saw outcomes weren't very different. The things that made the most difference wasn't how many supplements or pills you threw at somebody because of a genetic mutation. It had more to do with changing their diet and changing their lifestyle parameters and behaviors. So again, I hope that's helpful for you. Let's see. Is beef collagen or grass-fed beef okay when you have a fibroid? I have one, was told it is the size of a woman that's about 7 weeks pregnant. Don't want things that would make it bigger. So beef is generally just fine. Beef and collagen both, unless you're allergic to beef or wherever you're deriving your collagen from. People can be allergic to chicken, can be allergic to beef, and so if you're using chicken or beef collagen or even fish collagen, if you're allergic to the source of the meat, then yeah, that might not be a smart move for you. But as a general thumb, no, collagen grass-fed beef do not, make a fibroid worse. They're not, fibroids are not caused by protein. If they don't have their gallbladder, is it affecting the heart health and make people store fat in their arteries? No, remember, the gallbladder doesn't cause heightened or increased fat in the bloodstream. When you don't have a gallbladder, so an absence of gallbladder doesn't cause fat in your blood. An absence of a gallbladder prevents you from absorbing the fat into your blood. So it would, it would be the opposite of what you're saying. Now, don't get me wrong, if you're malabsorbing omega-3 does thin your blood, keeps your blood viscosity nice, and prevents inflammation in your arteries. So malabsorbing, not getting adequate omega-3, could increase your risk for heart disease because you need omega-3 to be heart healthy. But lack of gallbladder leads to not enough fat in your bloodstream, not too much fat. Remember, when we're talking about absorption, we're not talking about absorption from your blood to your cells. We're talking about absorption from your gut to your bloodstream. That's when we use that term malabsorption. We're talking about, are you absorbing the nutrients from the GI tract, from the axis of the GI tract into the bloodstream directly? Heather asks, my gallbladder was removed in 1998 when I was 18, but I gained weight so easily and losing it is difficult. Can that be malabsorption? It can be a lot of things, Heather. Yeah, not having enough fat, not getting enough fat. There's certain fats that are critical for weight loss, like CLA, conjugated linolenic acid, is very helpful in weight loss. And so it's possible that malabsorption is playing a role in that. It's also possible other things are playing a role in that. On a gluten and dairy-free diet, can I have green peas and pasta? Yes, you can, just if we're talking about strictly gluten-free. Now, if we're talking about no grain, no pain, phase 2, we cut out legumes during that phase. And again, not everybody needs to cut out peas and legumes, but this is, again, generalized in the diet, no grain, no pain. We do cut those out during phase 2 because some people have a harder time digesting them. Can low stomach acid cause malabsorption? Angela, yes, it can. Again, I mentioned this earlier, malabsorption of vitamin B12, malabsorption of minerals, and malabsorption of protein. I believe as family members losing muscle mass, 20 pounds underweight due to high alcohol consumption, what supplements may I suggest to help with this problem? Sadly, he doesn't want to address the alcohol issue. Rita, that's unfortunate, and I hate to hear that. because there's not a real great answer. I would say if you're going to do anything, one thing that might be positive, beneficial would be a very good B complex. So B complete would be what I would recommend. You might also have them use ultra nutrients, which is our multivitamin, multi-mineral, but just to get some nourishment into them. Alcohol consumption in high levels causes severe malabsorption and severe liver damage, and it causes B vitamin deficiency in a very big way. And so, it's the best you can do if he's not willing to cut out the actual problem, which is high levels of alcohol consumption. Is a functional medicine doctor or a naturopathic doctor capable of handling this kind of malabsorption issue? Debbie, it just depends. I mean, a lot of times people ask me, can you refer me to a doctor in this area or in that area? And a lot of times the answer is no. And the reason why, I'm going to give you an analogy. If you've ever like had a plumbing problem in your house, right? You call a plumber and they come out and, they do a terrible job. They don't fix the issue. The problem comes back just 2 days later, right? What you got was a bad plumber. And you didn't realize at the time that it was a bad plumber, but your experience led to the fact of understanding that that plumber was bad. And then maybe you call another plumber and that plumber comes out and lickety-split fixes the problem, and that was a good plumber. How did you know which one was the bad one, and how did you know which one was the good one? It's like that in the medical profession, in the natural medicine realm, in the functional medicine realm. Sometimes you get people who don't know what the hell they're doing. I'm going to just be very frank. I mean, I see this. I go to a lot of conferences every year for postgraduate education. And I run into people regularly that don't belong in the room. Like they don't have a knowledge set or a knowledge base that qualifies them to be in the room. And that's, to me, is a scary proposition because these people have patients. And so I really feel for their patients. But it doesn't mean that all doctors are bad either. A good one should be able to help you handle a malabsorption issue, but you've just got to do your diligence and make sure that you're finding one that has a great reputation that you can work with. Let's see here. Exocrine pancreatic insufficiency here, Laura says, would love some help. So yeah, if you've got exocrine, first of all, I would ask how that was diagnosed, because if you've got exocrine pancreatic insufficiency, most of the time it's diagnosed or it's identified by doing some testing. And so testing the enzymes like amylase and lipase, because those are produced by the pancreas. Amylase, lipase, and elastase are some of the more common ones. But if you've got pancreatic insufficiency, one of the best things you can do to support digestion is take a full spectrum digestive enzyme. Now, I have one called Ultra Digest if you want a gluten-free version of a good full support digestive enzyme. And so this is something you would take, you can take 1 to 2 caps prior meals. And the way you do that is about 10 minutes prior your meal to support your digestion. You're basically putting enzymes into your GI tract so that when the food comes, the enzymes are present in there and ready to help you digest that because your pancreas is underperforming. Now, it's important to understand that if you have pancreatic insufficiency, more than just taking digestive enzymes for the rest of your life, that you work with a doctor to try to help resolve why you have pancreatic insufficiency. And one of the most common reasons I see pancreatic insufficiency is got to do with gluten. Gluten is notorious for creating damage to the pancreas. Is it okay to eat squash and zucchini? Sure, those are not nightshades. It's okay to eat them provided you're not reactive to them. Let's see here. Yeah, so Tom's asking about a lab test. He says, lab test showed I'm low in B3 despite eating plenty of B3 rich foods. I'm taking a high quality multivitamin. I'm grain free. Any suggestions to increase absorption? So sometimes it's absorption. And if you're addressing your gut and your liver and your pancreas and your gallbladder, then no, you're not going to do much more to increase absorption outside of chewing your food more slowly and being in a parasympathetic state of mind when you eat. What does that mean? Parasympathetic is the part of your nervous system that helps you rest and digest. So what happens, a lot of people eat when they're amped up. They watch the news, right? In today's hyper-politicized world, and it's crazy out there. You can't listen to talk radio and you can't listen to the news and try to digest your food, because you'll have a major problem with your digestion. So being in a calm state of mind, right? A calm state of mind where you're sitting, you're relaxing, taking deep breaths, you're taking the time to chew your food appropriately, you're taking time to smell the food and experience the food. Like, the Europeans are great at this. The Americans, frankly, suck at it, because the Europeans take time to eat their lunch and time to eat their dinner, right? And they're in an environment usually that's very happy and loving. And so, but Americans are on the run and on the go. So those are things you can do to improve your absorption, is just to basically activate and engage your parasympathetic nervous system. But beyond that, there's not a whole lot more you can do. But you got to also remember, if you were tested, there's 3 reasons we can develop nutritional deficiencies. Now, certainly malabsorption is one of them, or damage to the GI tract. One of them is not eating enough of a particular nutrient in the diet, in the food that we're eating. And another, though, is an underlying need for more of a nutrient when your body's going through a healing process. So don't forget that last one, because a lot of times as the body heals, it's using more of the nutrient as it's putting things back together. We have a greater demand for certain nutrients when our bodies are trying to heal. And so sometimes people develop a deficiency because their body is burning through nutrients faster than what it might typically use those nutrients if it were already healed and already fully healthy. Let's see. I think I answered that one. Does using digestive enzymes on a long-term basis interfere with your body's ability to produce these enzymes naturally? No. Great question, Eileen. It does not. Absolutely does not interfere. Using enzymes is very safe. It does not lower your body's ability to make your own enzymes at all. Let's see. So somebody's asking about another lab. I don't like to mention bad things about different labs, but the only lab I recommend to identify gluten sensitivity is genetic testing. There's some other commercial labs that are out there that claim to measure IgG or IgA antibodies against other parts of grains or other glutens. And look, those tests are, in my experience, are highly inaccurate and highly misleading. But gluten sensitivity genetic testing is not. And if you're positive with gluten sensitivity genes, and you should avoid all grains. No questions, no ifs, ands, or buts, at least not in my experience or opinion. Robert wants to know, I had the gastric bypass surgery 3 years ago, definitely malabsorption, will have take vitamins the rest of my life. Yes, yeah, no question there, but that's true. You may not have to take massive quantities of vitamins the rest of your life, but you will absolutely want to measure your nutrition status on a 6-month interval basis for the rest of your life to make sure you're not coming into malabsorption in a big way. Because what happens is people let it go. They've had their gallbladder out for 6 or 7 years. They've had their stomach stapled for a number of years, and it builds. The malnutrition builds, and it compounds, and it becomes bigger and bigger and bigger. And the longer it's there, the greater the risk. So periodic testing of nutritional status is very critical in somebody who's had surgical removal of an organ. Can you supplement amylase, say a lipo, in mouth to swish around? Danielle is asking, can you supplement amylase? Yeah, you can supplement, and that's just a digestive enzyme. I don't know what you mean by say a lipo, but you can definitely supplement with enzymes before you eat your meals, and amylase certainly that is available commercially that you can purchase. What causes high arsenic? Eat lots of organic chicken and seafood. So depending on what your organic chicken eats, a lot of organic chicken are fed organic grains that can be high in arsenic. And so you have to look back again at where the source of the food, the chickens, is coming from, because heavy metals transfer from the meat of the animal into the human. Question about the low FODMAP. What about the low FODMAP diet? What about it? Like, what do you mean, what about the low FODMAP diet? Is it a good diet? Is it a not good diet? Low FODMAP diet is a very generalized diet that cuts out a numerous quantity of foods in individuals who have very poor digestion. It can be helpful, but not everybody needs to go that in depth in terms of their move, with diet change. Is there harm in letting a small ventral hernia go? Kristen, I wish I could answer that question directly, but what is a small? Small is a relative term. Without actually seeing it, and without knowing your history, it's really hard for me to be a judge of something like that. That's really more of something you want to speak with your doctor about. What can you take for fat malabsorption? I think I mentioned that earlier. Lipogest is what I would recommend, and I believe we even put a link up to that as well. I lost my appendix 50 years ago. Does the appendix have anything to do with malabsorption? I don't seem to have any health issues. Not so much malabsorption. What we're learning about the appendix, Mark, is that it's like a storage basket or like a rain check for your good gut bacteria. So the appendix stores a lot of your, we'll call them probiotics, but your microbiome, a lot of your reserve microbiome is actually stored in your appendix. And so removing it makes you more susceptible to disruption of your microbiome should you take things like an antibiotic or other drugs or other chemicals that might also act as antibiotics. Let's see here. Sorry, but my stools smell like red roses. I like that. Thanks for injecting the humor. I take an antibiotic called doxycycline for acne. If you're taking an antibiotic for acne, you need to ask the question, why do you need an antibiotic for acne? Acne is a skin disease, and generally it grows from the inside out. So there's a problem with something internally, and you shouldn't need, my point is you shouldn't need an antibiotic to control acne growth on the skin if your diet's dialed in and you're doing the right things with nutrition. Let's see, Bhupender's asking, what's a way to buy our products if you live in Australia? I can't make purchases. It's only limited to Canada and America. One of the only ways that we can right now at this point in time is that we ship to Australia is when I'm working with a client directly. So if I'm working with a client directly who's living in Australia, we actually, not through Gluten-Free Society, but through our clinic, we'll ship things to that client. So that's really one of the only ways I know to get Gluten-Free Society products overseas at the moment. We're working on some distributorships that we may see coming online in the future, but right now we just don't have them. Let's see. On an ion Genova test, all fatty acids are high. Is there a genetic reason for this? No, but I also don't trust an ion Genova test to measure fatty acids. It's just not a great read on measuring for fatty acids. So not the best methodology for testing, in my opinion. Let's see, Yesenia, a gluten-free child with burning feet every night lasting 12 to 15 hours. What can be done to provide relief? So you mentioned gluten-free child, but is the child true gluten-free, grain-free? So that would be one element to consider. The other would be get that child tested. It says burning feet is a neurological, generally it's a neuropathy. And there are a few things nutritionally that can cause burning foot syndrome. It's very painful, but B5 is one of the most common, B5 deficiency. Also B12 deficiency and folate deficiency and B1 deficiency, vitamin B1 deficiency, all those things can cause a burning foot neuropathy to occur. Thoughts on high-dose vitamin D, thoughts on human milk oligosaccharides. I think human milk oligosaccharides are great. I think high-dose vitamin D used in the proper way is fantastic. I think abused and used improperly isn't fantastic. Mike is asking, can I take Lipogest even if I have a gallbladder? You can. Some people struggle with gallstones or have sluggish bile production, and so something like Lipogest can be supportive and helpful. Gloria is asking, I have sarcoidosis. I had COVID twice, had blood work done, and my vitamin D level was 9. So knowing my doctor told me to take vitamin D, but I tried low dose. But on my 5th day, I started having a pain around my kidney area. I'm sure it was the vitamin D. It may have been. What you would want to do, Gloria, if you were going to take any amount of higher level of vitamin D, is really monitor your serum calcium level, because that's really the risk with sarcoidosis. It's that serum calcium level can go up, and that can create a greater risk for stones. It can create a greater risk too for cardiovascular events. So you just have to monitor it carefully. The other way you can get vitamin D where it shouldn't really have a major impact is just good old-fashioned sunshine if you tolerate the sun. I know it's harder to do right now in the winter, but some people actually use tanning beds in winter months, not to tan, not to go in and lavishly tan your body, but it's just a few minutes of exposure a couple of times a week can go a long way toward naturally improving the vitamin D production from the cholesterol in your skin. So Cindy's asking about, what if your vitamin D is too high? Mine was almost 2,000. If you're talking about serum values, and if you're supplementing with any B12 at all, you're always going to have high serum values. Serum values are not an accurate indicator for vitamin B12 absorption into your cells. So if you're monitoring your serum vitamin B12 to ascertain whether or not you're taking too much B12, it's the wrong test. You're approaching it in the wrong way. You've got to look at intracellular vitamin B12, functional outcome vitamin B12 testing to know. Tara's asking, does your book discuss how to heal fat and protein malabsorption? My book doesn't go specifically at, hey, chapter 3 on healing from fat and protein malabsorption. My book goes into whole body healing. So, I would encourage you to read it, because I think if you apply it, I think, anybody that applies it, that especially that has a gluten issue, is going to take themselves a long way toward healing any kind of malabsorption problem caused as a result of food. What's the best daily supplement? I mean, my favorite, I'm biased, but I designed it. It's called Ultra Nutrients, and so it's my favorite daily supplement. I've talked about this, April, in the past. There are supplements that I recommend. We have a grouping of supplements. If you go to our shop on Gluten Free Society, but it's called the Gluten Free or the Gluten Essentials bundle. Maybe we can put that link up, but a multivitamin, omega-3, probiotic, all what I would consider to be essential baseline supplements if you're just getting started. Some ways to increase stomach acid. Number one, you got to eat well. Your stomach can produce acid, but if you're not eating well, or if you're doing something that inhibits it, it's not going to make stomach acid. You can increase acid. What some people do to help aid digestion is take a little bit of apple cider vinegar before a meal, because it has a mild acidic effect. The other thing you can do, we have something called ultra acid, which is a supplemental acid that you can take. But if you're trying to increase your ability to produce stomach acid, you first have to identify what's causing any kind of damage to your stomach and address and deal with that, and hopefully see from there your stomach be able to heal, repair, and recover and start making stomach acid in adequate quantities on its own. If you have a pancreatic insufficiency and don't tolerate enzymes, you have to ask, in my experience, a lot of people that don't tolerate enzymes, it's for a number of different reasons. A lot of popular enzyme products, Michelle, contain rice powder in them. And I've seen this time and time again, where people are on an enzyme formula with rice in it, on an enzyme formula with corn in it, and they think they don't tolerate enzymes, but they actually do. They just have to get on a true gluten-free type of enzyme, and they find that they tolerate it really well. Mary Beth asking about kombucha. Yeah, I think kombucha is junk food. I don't recommend it because it's basically water with sugar and alcohol, and they have to sweeten it, otherwise you wouldn't want to drink it. But there's too much sugar left in kombucha, and there's alcohol as a byproduct. It's just not a healthy food to consume. I know it's highly popular right now, but it's just not a healthy food. My B12 is high, 1800. How am I absorbing that, but yet magnesium is low after taking megadoses of mag citrate? So again, Denise, it depends on how you were tested. It's a big issue in testing of nutrients. And somebody asked the question, is a naturopathic doctor or a functional medicine doctor, are they good? Could they handle malabsorption if I go and see a doctor like that? And again, it's the same thing. What kind of doctor is best to measure nutritional status? It's not the type of doctor, it's the nutritional education and the understanding of cellular biology that the doctor has. If they're running the wrong types of tests to do the measurement, tests that are inaccurate or that are misleading, you're going to get really confused really, really quick. And I would suggest, Denise, that that's probably what's happened to you. Again, your B12 is high. It's most likely high in your serum, which is no way to monitor B12 levels. If your magnesium is low, how did they measure that magnesium? I don't know. Did they measure it in your red blood cell? Did they measure it in your white blood cell? Did they measure it using lymphocyte proliferation? Like, what was the mechanism of the measurement? Because it's hard for me to give you a really distinct answer without having that information. Again, this is where a lot of doctors, in my experience and opinion, fail to properly address nutrition because they don't know enough about the technology that they're using or the testing methodologies. And so they're just measuring something for the sake of measuring it without understanding the nuance. Yeah, so just some commentary about people not getting, as I talked about earlier, people never getting any kind of counseling in nutrition prior to a surgical procedure. How do you get your nutritional status measured? It in a lot of different ways. I mean, there's a lot of different ways to measure. It depends on which nutrient we're trying to measure. We're working on a direct-to-consumer measurement where we measure multitudes of different nutrients, the main ones. All the essential nutrients. I've mentioned that before. We're coming to fruition with that, and hopefully we'll have that available to folks here very, very soon. But it's a type of intracellular functional outcome analysis, very, very much what I use in my clinic, but till now it's not really been available direct to consumer, and that's what we've been working on. Because the problem is, as most of you know, you go to your doctor and ask them to measure it, and they don't know what they're doing. They didn't study nutrition. They don't have an expertise. They tell you it's not important. They dismiss it as unimportant. They look at you like you're crazy, and then you have no recourse, and you have no way to actually get it truly measured. And so that's part of why my team and I have been really working diligently on trying to make this available to you folks. So just be patient with me. I promise we're going to have it ready, if not by the end of this quarter, but by the end of the year for sure. I mean, we're there. We're this close. Will enzymes work if taken in the middle of the meal? Yes, they still work. Even if you forgot to take them before the meal and you take them in the middle of the meal, they're still going to give you some enzymatic activity, and they're still going to help support your digestion. Somebody's asking, do I suggest taking Ultra Digest if you no longer have a gallbladder? You can take it. There are fat digesting enzymes in Ultra Digest, but again, I really recommend, without a gallbladder, I really recommend Lipogest because the issue with the gallbladder removal is going to be more about bile and less about enzymes. Remember, your enzymes are produced by your intestine. They're also produced by your pancreas. So the gallbladder itself is not as key as far as the enzyme production. That's more your bile production. Best way to treat chronic constipation is to identify what's causing the chronic constipation. Michelle, I know that sounds like a workaround answer and it doesn't give you clarity, but a lot of times the constipation is as a result of a number of different factors. What I would encourage you to do is, I did an entire show, it's called How to Poop, right? And if you go back and review that show, it's about an hour and a half long, but it might give you some better clues and insights than what I can go into right this moment on resolving a constipation issue. What should I feed my chickens to keep them from feeding them grain? Chickens can eat grain. I think it's where you're sourcing your grain. If we're talking about heavy metals, as I was mentioning earlier, but your chickens shouldn't have a staple diet of only grain, and that's where a lot of farmers, in my opinion, go wrong. Your chickens should graze. They should eat insects. They should eat mealworms. They should eat things like flax meal. They can eat chia. I mean, chickens can eat a lot of things beyond grain that are not going to necessarily be contaminated with heavy metal, and you really just have to you have to investigate all those. I mean, that's what we feed ours. We feed ours, when we do feed, we're in Texas, so they can graze year round because it's hot. It's that hot down here. But if I live further north, I probably would use a lot more flax meal. I probably would use, a lot more mealworm in my food preparation. But I would also use some organic grain. Remember, chickens by default can eat grain as a species. Their GI tracts are designed to process that. It's just quantity and it's quality as well. And one of the problems with heavy metals in grain is predominantly it's rice, not so much, where you get heavy metal. Rice, wheat is another one, but you really want to look at with your chicken meal. You want to look at something ideally that's wheat, rice, and preferably soy free, because that's where you get a lot of the contamination issue when it comes to chicken feed. I have celiac and malabsorption. How can I help get the correct amount of nutrients? Stephanie, number one, start with a true gluten-free diet, not the traditional gluten-free diet that you probably were guided toward when you got your celiac diagnosis. And if you don't know what that is, let's put a link up for Stephanie. We have a free 14-hour masterclass, Stephanie, that you can take to understand gluten better. A lot of people I see that have a celiac diagnosis, they've been told everything wrong. They've been told everything to how to go gluten-free the total wrong way, and they continue to struggle with issues until they learn what's in this master class. And again, you can take it. It's absolutely free. It's about 14 hours long. You do have to commit your time to getting the education, but we're going to put a link up just for you, Stephanie, on the Glutenology Masterclass.
I'm Dr. Peter Osborne, founder of Gluten-Free Society.
Red blood cells are always low. How
can I increase this? I'm also anemic. No grain, no pain.
What red blood cells
you might recognize me from my appearances on Fox, PBS, Netflix, and many other nationally recognized publications.
It depends on why they're low. A lot of times I see red blood cells being low as a result of vitamin B12 deficiency, folate deficiency can cause
the ultimate master class on going.
So those are just two places, simple places to start. The key would be to identify why they're low. Again, there are a number of reasons why they could be low. You might have a hemolytic anemia where your red blood cells are low because they're breaking open too prematurely and they're not living out their 3 to 4 month lifespan, and that could be a vitamin E deficiency or a vitamin C deficiency. So, it just depends. I wish it were a simple question and I could give you an exact answer, but it's varied. All right, let's see here. Somebody's shouting dinner time. Yeah, it is, isn't it? It's 7:25. My stomach was growling, and I think you were reading my mind, Sue. It is. It's dinner time, and we've gone over, and I've answered a lot of questions. There's a lot more. Look, I want to do my best to answer your questions. Do me a favor. If you've got questions that you'd like me to answer that are just burning a hole in your mind and you have a desire to learn more, you can also shoot those questions over to me and just email me at glutenology@gmail.com if you've got questions. And again, next week we'll be back for another live Q&A session every Monday night at 6 p.m. Central Standard Time. If you are new to the show and you want to get the email to the link so that you can come and attend on Monday nights, make sure you go over to glutenfreesociety.org and sign up there for our newsletter. That is the number one way we can prevent censorship, is that you're on my newsletter, where I know for a fact that the notifications are coming to you. YouTube constantly censors us. Facebook constantly censors us because truth is lies and lies is truth in today's climate. So if you want uncensored information, you want to get access to my brain every Monday night, make sure you sign up for my newsletter over at glutenfreesociety.org. Look, I wish you all an excellent week. We'll see you back next Monday for another episode of Pick Dr. Osborne's Brain. Have a great evening. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.